So, the first thing that I noticed with this client was his posture. And in order to fix his posture, I would ask him if he's able to stand up straight. If he's unable to do that, I would ask him to pull his shoulder blades together. And I would want him to be doing this every 10 minutes each hour to help strengthen those scapular and back muscles, which would then improve his posture. I think that this client is appropriate for electrical stimulation, specifically TENS, due to his pain levels and him having an acute injury. So the parameters I would use is I would use a high frequency simulation because I want the effects to be a sensory effect to help reduce the pain that he's feeling. I would use a biphasic pulsed waveform because I want to be using two different phases that have the same parameters. So during the treatment, I would use a pulse frequency of 80 ppс. I would start low because I want to be able to test the tolerability of the client and be sure that he's able to handle the TENS. And I would also use a pulse duration of 50 milliseconds, again, starting lower and being able to work my way up through treatment. I would then ask the patient when the simulation started to feel good for him and set that as the amplitude, and the entire duration of the treatment would be 20 minutes. So, two electrodes I would place on the upper trap to help stimulate that muscle and help with the pain in his trapezius. And then I would also want to place one electrode on the posterior cervical spine and the final electrode on the upper thoracic region. The two electrodes on the trap would be on one monitor, and the other two would be on a different one. Again, using that biphasic waveform. A functional activity that I would then have him do is upper body dressing, because he wouldn't be feeling a ton of pain after the TENS treatment. I'd want him to start working on maintaining that upright and correct posture while he's getting dressed to work on that muscle memory.